One of my own patients, who I've taken care of since 2009, Beverly Brewster, is an attorney in Tallahassee, Florida, and she was kindly agreed to come up and tell you about what depression is like and somewhat about her story and what life has been like for her living with depression and hopefully being better since we began working together. At least I'm hoping that's what she's going to say. So without further ado, let me introduce Beverly Brewster. Beverly?
Hi, my name is Beverly, and I want to thank everybody for coming today and for asking me to come and speak. There is nothing sexy or attractive about the word depression. It's not a glamorous kind of diagnosis, and it's become too common in our everyday parlance where somebody will just say, "Oh, I'm just depressed today." It truly is a brain disease, and I struggled with it all my life. Of course, when I was growing up, I don't even know that there was a diagnosis of depression. I just knew in high school I was very sad all the time. I would appear happy, but inwardly, if anything good happened, it was a matter of, so what? When I got to college, that kind of constant sadness continued, and if relationships broke up, I could not get over it. It would take me years to get over it, and I know that must be a manifestation of my depression. I did not seek professional help for depression until I was in my 30s, and at that time I went to see a family therapist who worked at a local church, and the talk therapy was very, very helpful in dealing with the situations that I encountered. But I realized it was not addressing the brain chemistry, the real problem of changing my brain chemistry, so I would not have that underlying sadness, hopelessness, and despair. I grew up in Tallahassee, and I went to a family friend who was a medical doctor, and I told him, I said, "Look, I've got this terrible sadness all the time. I can't seem to shake it. I've tried Prozac, I've tried Zoloft. I get irritable, I have a quick trigger switch," and he said, "You probably need to see a psychiatrist. You may have some mental illness." So I wasn't too proud. I was fine to go ahead and see a psychiatrist. And the first diagnosis that was given to me was, "You're bipolar type 2." And that kind of shook me up a little bit because that's manic depressive, and everybody knows scary stories about that. But he was a psychiatrist, and he was well respected in my community, and I stayed with him for several years, and he kept prescribing drugs, and I kept taking it, and years would pass, and I would have lunch with my friends, and they would say, "Beverly, you've been seeing Dr. So-and-so for years, and you really know better." And I would look in my medicine cabinet, and I would have 10 pills every morning or whatever it was, and so I went back to him, and I would say, "I need to see somebody else." So I would close that relationship, and I would see another local prominent psychiatrist who, to my knowledge, did not question the original diagnosis. So we continued on in trying to treat bipolar disorder, throwing in different new medications, and I would go in and say to him, "I'm taking 5 medications and I'm still not better," after quite some time. And he would say, quote unquote, "Well, there's a new one, let's add this to your cocktail." So I would try it. And then finally I said to myself, if I had something wrong with me like cancer or heart disease, I would seek out the best professional help I could get to treat that physical disease. If I had heart disease, I'd probably go to Emory. Or if I had cancer, I'd try to get to MD Anderson in Dallas. Or is it Dallas, Houston? So I said, I need to apply this to mental health. And I literally went online and looked up U.S. News and World Report's ranking of hospitals and medical centers. And in the South, one of the highest ranked at that time was Emory. So I sent an email to the Department of Psychiatry at Emory, and I said, in very few sentences, "I've been diagnosed as bipolar disorder. I've never tried to commit suicide. I've never been hospitalized, but no one seems to find the right medication for me." And they suggested 2 doctors, sorry about this, the older of which was Dr. Nemiroff. So I decided I'll go to somebody that's a little older than me. I made my appointment, I got in my car, and I drove from Tallahassee up to Atlanta. I met with Dr. Nemiroff. And after he reviewed my file and the many medications I'd been on and the fact that they hadn't worked and my own situation, he said to me, I don't think you're bipolar. I think what you've got is treatment-resistant depression. And at that time, as I said, he was in Atlanta and I was in Tallahassee. So I coordinated with a local psychiatrist, yet one who I had not seen, who had studied under Dr. Nemiroff, to start from scratch and go from medication to medication until we could find one that may or may not treat my depression, knowing that it might be a situation where I would never find one. This went over for several years, and Dr. Nemiroff then went down to University of Miami, and I communicated with him there and visited him there, and we finally did find a pill that would work for me. So I started taking this particular antidepressant, which, can I say the brand name? Brand name is Remeron, and I started gaining a lot of weight. So I found out that Remeron, like a lot of other medications that treat depression or mental illness, will cause weight gain. So I went to my regular internal medicine doctor and I told him about my Remeron, and he said, you know, when I was an intern, he said, we used to give Remeron to patients who were in nursing homes to help them put on weight. So I had the choice of continuing with the antidepressant that would help me feel better. I got to the point where I was not considering suicide every day. And it was never a dramatic thought like, oh, I'm going to commit suicide, you know. And it was just like your best friend might be. But life had absolutely no joy. And I would sit there trying to think of a way that I could end it without things being too messy. Luckily, this particular antidepressant worked for me, but I had to make the choice of whether or not I wanted to suffer with the side effects, mainly the weight gain. There was a time when I did go off it because I was tired of being so fat, and it wasn't too long before my mood started to sink again, and I became irritable again, and I got back on the Remeron. Today, I don't ever think about depression. And I know so many people out there who are in a community who have seen one or two psychiatrists, even in my own community, and they think that if those doctors do not have the answer, there is no answer. And the one thing these people need to have is hope. Just because if you know somebody in a similar situation, if they've seen 2 or 3 doctors in your community, encourage them to treat this as a brain disease. It's a medical disease. Where would you go for the best treatment? And try to get them an appointment. Now, luckily, I had the type of insurance where I could just make the appointment online. That has been a stumbling block for a lot of people. But I was able to do that. I had the freedom to do that. A lot of people don't. It takes energy to fight this, and if you don't have the energy, then sooner or later, I'm afraid you're just going to give up. So it's important that people are given hope that this can be taken care of. If I could talk to psychiatrists, I would say, don't get lazy with your patients. I think all professionals do. Don't fall into that rut. If somebody comes in and they're not getting the proper treatment and they're not turning around, after several years, swallow your ego and question whether your diagnosis has been correct, or help that patient get help with somebody who may approach it from a different angle, or somebody who may be at an institution that has the funding, that can get the proper research and get on the cutting edge of what's going on with depression. To patients, or if you have friends who are depressed, and I think everybody does. My water? Is this my water? Thank you, sir. Dry mouth is probably part of the side effects. But if you do have friends, don't let them give up. If they have to put, a trip on their credit card to get proper medical care, get them to see somebody else who is not in the same community, who doesn't go to church with the same doctor that you're currently seeing. Get them out there to somebody who's exposed to what's on the cutting edge in mental illness. When I first went to see a psychiatrist in Tallahassee, the first thing I said to him was, please see that I make it to age 50. And he did do that. I made it to a little past 50. But it's important that people who have depression, and if you know them, or if it's you, knows that there is hope out there. But as you know, it's not something like you hurt your knee and you get an MRI and the doctor looks at the MRI and he can diagnose it. The doctor is limited in diagnosing with so much these days in some communities with what the patient actually tells them. And it's a subjective kind of thing. I would like to see it get to the day where somebody can take a blood test or do a MRI and say, well, you're prone to some type of mental illness, or you're not, maybe we're getting there. But until we really see mental illness and depression, be careful how you use that term, as truly a brain chemical disorder in the brain, and start treating it and educating people on that, I fear we're going to lose more people to suicide, and it's really not necessary. So in that vein, I don't know that I really have anything else to say. There is hope. I'm now participating more in my community. I have friends, and as I said, I don't think about depression. I do dog rescue as my hobby, and I continue to practice law for the state of Florida, which has its up and down rewards, but if you're on the right antidepressant, you can get through that too. So anyway, I'm just here to tell you that it can be treated. It takes time. So whoever you know that is depressed, just tell them not to give up and to keep hope. Thank you.